Bismillahirrahmanirrahim. My name is Dr. Waqar. I am president of افtalmalوجی National Medical University. Today we will have an easy approach of strabismus management with Sahaf triangle. Professor Muhammad Imran Akram Sahaf, he is a retired professor of ophthalmology from King Edward University. I have met him about 2 years back in Lahore, Oftalmo, and when he has presented this easy approach for Sahaf triangle, that was amazing. So, if we just give a very brief definition of strabismus, that is when visual axis of both eyes are not directed to the same point. Misalignment of the eyes. One eye is seeing north, one eye is west. Yes. So this is the very simple and easy. So we have some cases which is practical in routine cases we have in OPD. So this is the patient number 1, 2 months old baby with left eye unilateral esotropia presented to OPD. Esotropia is since birth. Extraocular movement is normal, fundi are normal. Everything is normal. Just we will have a 1 minute discussion, then we will go. For example, what is your management for this particular
observation? अगर उसकी फंडोस्कोपी रेटिनोस्कोपी पे कोई उसका वो नहीं आता है एरर, फिर हम उसको ऑब्जर्व करेंगे. इन्फेंटाइल एज़ोट्रोपिया ना, तो इसमें हमने ऑब्जर्वेशन करेंगे.
Please. Faraz bhai. Until which observation?
3 monthly उसको follow up करेंगे.
अच्छा. Then, so it will recover spontaneously. Okay, you have done no refractive error. Okay, no problem. We have a case number 2. Inshallah, we will discuss. Case number 2. 12-year-old boy with alternate convergent strabismus presented to OPD since this alternate strabismus is since birth. His vision in both eyes are 6/9. Extraocular movement is normal, fundi are normal. This is the patient. There is a convergent squint. When we are, this is in the same patient but in the other eye. Alternative squint, 6/9 vision, fundi normal, 12 years old boy. Please, what is your management for this particular patient?
Surgical correction. सर्जरी करेंगे उसके कॉस्मेटिक रीजन.
Okay. Then just you will do surgery.
Refractive error correct करेंगे उसको.
Okay. Then
before going to surgery, can we check for post-operative diplopia?
वो तो सारी चीजें
assessment हो गया.
अच्छा. Then चले. So in session, this is a multiple session. In session number 1, we will have a basic of Sahaf triangle for management of strabismus. Just we will study basics in very simple cases. These 2 cases that we have studied and how we can solve this. So the commonest question asked by parents: if you have a baby like this, 2-month baby, what will be your more concern from doctor?
ठीक हो जाएगा, विजन को तो नहीं इफेक्ट करेगा.
Good. Another question?
आँख सीधी हो जाएगी.
Good.
कहते हैं कि खुद ही सीधी हो जाएगी, जैसे जैसे कि बड़ा होगा तो ऑपरेशन की आँख सीधी हो जाएगी. हाँ.
अच्छा. Next.
फर्स्ट इज आँख सीधी हो जाएगी, सेकंड इज की नजर तो खराब नहीं होगी, थर्ड इज
दोबारा नहीं सीधी. So ये सवाल वो है जो एक मरीज करता है. पहला, क्या ये आँख सीधी हो जाएगी? The most common concern. 2-month baby, very beautiful. So दूसरा, ये दोबारा जाएगी, टेढ़ी तो नहीं जाएगी. Doctor, will the eyes be straight after operation? Question number 1. After operation, the eyes will be straight, and will they stay as such? Okay, you have straight for a 2 month, 3 month. That will be straight forever, or after 3 months it will go like this again. Second question being more important. For example, in some patient we are doing surgery for 3 months, 6 months, his eyes are straight, but after 6 months, eyes are going like this. So, without Sahaf triangle, answer for this question is so difficult. We cannot estimate. Because if you don't know this basic of Sahaf triangle in management, so it will be so difficult. And sometimes you will say it will not fit. Sometimes you will say maybe. So just in Strabismus management with Sahaf triangle, just I will ask you, Dr. Ahmed, why you don't have Strabismus?
Because both of my fovea are corresponding retinal elements.
Achha, good. Next, Ania. Okay. Next. Achha. In other words, what makes the two eyes look at the same point? We will have answer for this question, no problem. In other words, what makes the two eyes look at the same point? Why we are looking at the same point normally? My eyes are not like this, okay? When relaxed like in sleep, eyes are directed in all sorts of abnormal position. We know that when we are in sleep, our eyes are going upward and laterally. Why? Why not when we become awake? It's a question. What brings them together when we wake up? Achha. The next question will be, once brain decides to view an object, how does the brain know present position of eyes? So how my brain now know that my eyes are straight? Ji? So how my brain know? No problem. We will come to these questions. These are just a question that we will answer one by one. If the eyes itself which tell their position, it is the eye. It is the eyes itself which tell their position to brain through the afferent pathway. We have afferent pathway. Okay? Optic nerve. Information taken to the visual cortex. This information, if there is no afferent pathway, brain will not know where to focus the eyes. For example, in patient of cataract, congenital cataract, maybe you have seen the patient has esotropia, exotropia. So there is afferent pathway problem. So this is the intact afferent pathway that our eyes say to visual cortex. Intact afferent pathway are needed to tell the brain position of eyes before and after focusing on an object. Before and after. Our eyes tell to the visual cortex that there is intact afferent pathway, you have to be straight. Or if there is cataract or any kind of problem, so simultaneously the eye will, there will be no stimulation from the eyes. This information is relayed to fusion center in associated visual cortex. Okay? So from this eye, afferent pathway going to visual cortex, from this eye to visual cortex, so my eyes are straight. These are basics, okay? We have one fusion center. What is fusion center? This center coordinates the gaze and simultaneous focusing of visual axis on the object being seen. Okay, this is a center which is in the visual cortex, and coordination between the two eyes is carried out by the fusion center through the afferent pathway. Understand? These are one line. This is important for the management of that particular cases. Coordination between the two eyes is carried out by the fusion center through the efferent pathway. Okay. information you have bring, okay, from the afferent pathway to the visual cortex, to the fusion center. Again, these information will come again through the efferent pathway, okay, and that if this three pathway, afferent pathway, fusion center, and efferent pathway, this is intact, so our eyes will be straight. So now my eyes are straight due to these three phenomena.
First intact efferent pathway, second
Yes.
is fusion center, another is intact efferent pathway.
Efferent pathway, good. So what is efferent pathway? We have studied afferent pathway, we have studied fusion cortex, then efferent pathway. In efferent pathway, these have some gaze centers, tracts, optic tracts. We have motor nuclei. Maybe you have heard about internuclear ophthalmoplegia. In some patients that occur, the eyes going like this. That is, when I first joined department, there was one young girl. She came here. She had internuclear ophthalmoplegia that has been diagnosed by Dr. Naushirwan sir. And he has he has advised high dose steroid. And when the patient came after 2 months or 1 month, she was okay. So motor nuclei, motor nerves, we have different motor nerves. Sixth cranial nerve, third cranial nerve, fourth cranial nerve. If these are intact, okay, neuromuscular junction like in myasthenia gravis and all muscles all constitute the efferent pathway which carries order from the fusion center. What doing this? They bring the order from the fusion center. These are parameters. Then, so what causes strabismus? This is the next question. Strabismus can be caused by defects in either afferent pathway, fusion, or efferent pathway, or a combination of that. For example, if I have problem in my afferent pathway, like cataract, okay, I have a problem in fusion center that is not developed. We will say later when it will develop. If I have problem there, okay, so I will have strabismus. Intact afferent pathway, intact fusion center, intact efferent pathway. So what afferent defects commonly cause strabismus? We have different kind of afferent problem. Just I will ask again that tell me commonly associated problems of afferent system leading to strabismus. Afferent problem.
starting from
G.
cataract
Good.
या फोटोसिस है जो
Good.
विजुअल एक्सिस को कवर कर रहा है
Good. Then
हाई मायो
good.
retina पर कोई मसला है
Good.
कोई मसला नहीं नाम बताओ
Yes, it's overall, no problem. Anyone? She said cataract, refractive error, corneal opacities, optic nerve problem. Then
And lesion in this pathway, coloboma.
yes, you are right. So we are now gradually we are entering to strabismus practical steps. So we are gradually entering practical management of strabismus. These are the commonest cause of strabismus we come across. Okay? Corneal opacities, Rai Farouk. Cataract, Dr. Raksa. Vitreous opacities, vitreous hemorrhage, or anything. Retinal disease, like optic nerve disease, Dr. Ahmad Masood. High refractive error, Dr. Hira. Congenital ptosis, good. And sensor amblyopia, good. So these are all afferent problems that can cause the afferent. Acha. So in summary, what we can say? Strabismus is prevented in normal person through coordination between afferent pathway, fusion center, fusion, and efferent pathway. Defect in any of these or in combination of can lead to strabismus. Okay? What we have done until now? Just afferent pathway we have discussed. Okay? We have given a general idea. We have studied the different afferent problem which can lead to strabismus. That was we have studied. So there are some efferent pathway. What efferent defects lead to strabismus? Defect in gaze center, motor tracts, internuclear ophthalmoplegia, if there is some kind of inflammation in the nucleus, that we have different nucleus in our brain stem. Third cranial nerve that has for both cranial nerve different nucleus. Motor nuclei, motor nerves we have 3 motor nerves which rotate our eye, third, fourth and sixth cranial nerve. Neuromuscular junction like myasthenia gravis, and muscles. Here is some we have a contracture of muscles. Okay, so these are efferent problems, afferent and efferent problems, which can, if there is any kind of problem in these parameters, for example your fusion center, okay, but problem in this, they will not bring the order from here. So this is a triangle. It has afferent pathway. Okay, afferent pathway will bring to the fusion center. Okay, and fusion center will bring the order to afferent pathway. So my eyes are straight. I am looking straight for us. Okay. So there are certain problems that can damage fusion. Certain problems that can damage fusion. Be careful. Be patient. This is very important. Problems with fusion. Ari? There are certain problems that can lead in fusion. We have studied afferent, efferent, and fusion. In fusion, there are certain problems. It can be damaged by trauma. Okay? It can be damaged by tumor.
Tumor infarction.
Yes, infarction. Good.
Serious escalation.
Most common non-development of fusion. For example, we will come later when we are developing fusion. More children that they have this strabismus, they are not developing their fusion because fusion developed in childhood. Okay. For example, strabismus who was presenting in childhood, they cannot. There will be problem with fusion. So we have found 3 tiers for strabismus: afferent, fusion, efferent. This is afferent pathway, fusion center, and efferent pathway. So it is one thing I will say, that is it not important that you have to observe all these kind of information in one session? We will study. If you not understand, we will study again. These are the information that you will absorb. Maybe I have spent more times, 2 years. अच्छा, in a sense,
एक सवाल जो होता है एनाइसोमेट्रोपिया, उसकी वजह से जो स्ट्रेबिस्मस होता है, तो वो किस पाथवे में है? एफरेंट में है, फ्यूजन में है?
Anisometropia. So what will you occur? Anisometropia. In anisometropia, there is a high refractive error. So that is afferent pathway. We will come to that. Don't worry. So just remember afferent pathway, fusion center, efferent pathway. In summary, afferent pathway, fusion center, efferent pathway, their help prevents strabismus, and defect in any or in combination can lead to strabismus. This is the basis for Sahaf triangle. If you know these 3 pathways, this is the basis. We will study different scenario, which is most common routine cases. This is not a single scenario that I have said to you. For example, in one case, Dr. Afshar will have 5 strabismus, okay, in one list. and that all patient will be within 4 months. Okay, that will be all patient will be 4 month age. What I said to you. Another patient, the developed patient like 12-year-old, you will have 2 cases. Just if you know the basis, it's just a formula. It is a law. It is a rule. They are giving rules. It's not a case, just one case, that you will solve that particular problem. It is a rule for the children. It is a rule for the adults. Okay? Acha. We will study different scenario, which is most common routine cases. You will agree with 2 things, that we basically stressed on 2 things using Sahaf triangle. Number 1, logical dissection of problem and systematic solution. Okay? Logical dissection. We will use our neurons. Okay? And then systematically we will solve. Okay? Systematic solution. We will dissect everyone. Afferent pathway, then fusion. Number 1, you have to agree with this. Number 2, prognosis of management of squint relying totally on fusion after other parameters are normal. Number 2, for example, your afferent pathway is normal, your efferent pathway is normal. Management is relied on fusion center. If you have done everything, okay, we can control, we can do surgery on muscle. Okay, we can correct refractive error. Refractive error is afferent pathway. Surgery is efferent pathway. But if your fusion center has problem, so the management based on that. Case number 1 that we have studied. 2-month-old with left eye unilateral esotropia presented to OPD since birth. Extraocular movement normal, fundi are normal. There are something which is so important. Number 1, 2-month-old. Okay. Number 2, unilateral. Okay. Number 3, since birth. These are so important. And we have to, again, the patient came to you in Dr. Fatima is ophthalmologist, and the parents of the question will ask this question. Oh, you know this, afferent pathway, fusion center, efferent pathway. Sorry, what was the question? ये आप सीधा हो जाएगी? दूसरा? ये ऐसा रहेगी या नहीं? Okay, you have done a good surgery, you have taken your fees. Okay, but after 6 months, again the patient will come. भाई ये क्या किया? So if you know the triangle, this you can charge double, triple, because no one can give such a high reliability, and you can say everything will be okay. So this is afferent pathway, fusion center, efferent pathway. We will dissect logically. Okay?
In this child there can be a defect at fusion center, क्योंकि अभी तक वो fully develop नहीं हुआ.
Let's come. मैंने कहा कि you have to agree with me. Dissect, then dissect, and we will systematically solve this. Logically. Now we are studying what we had in afferent pathway. These problems. Patient had corneal opacity? No. Cataract? No. Vitreous opacity? No. Retinal disease? No. No optic nerve disease? No refractive error? No congenital ptosis? No sensory amblyopia in this age. So our afferent pathways.
Refractive error को आपने किस तरह?
Yes, refractive error.
उन्होंने अगर रेटिनोस्कोपी कर ली उन्होंने कहा कि हालांकि होना चाहिए बच्चों में वैसे 0.5.
Yes, I have given.
सारे हाइपरमेट्रोपी पैदा होते हैं.
नॉर्मल है ना फिजियोलॉजिकल
पीडी में तो सारे आते हैं सबका एरर निकलता ही
वो तो उसकी रिफ्रैक्टिव है.
तो उसको नहीं पूछो, उसको हमने क्लास में थोड़ी देनी.
लेकिन इस स्लाइड में आप इस रिफ्रैक्टिव का एरर को हटा दें, फिर ये स्लाइड बेहतरीन है.
One thing I will say, chalo, if you are happy with that has -1 or +2, okay, no problem. There is a problem in applying glasses. If you give for 2-month-old, that is not that is not problematic. That will not create a problem for you. If that have or not have, okay? Chalo, you are happy with -2 or +2. Okay, our afferent pathways.
Why minus? It should be plus.
भाई मैंने कहा कि please logic just you are open. I am giving a rules. Okay, not a case. Our afferent pathways. Okay. Now we are coming to fusion. Fusion developed in this patient? No. Fusion not developed until now. Because fusion not developed in this particular 2-month-old baby until now. Once developed, never lost. Once developed, never lost. Okay? For example, if a baby has straight eyes, okay, for his or her 5 year, 10 year, after that there is strabismus. So again you can go for surgery or any kind of intervention, because you can give the estimation that the patient eye was normal in a time.
Okay. He
So-
or she has developed his fusion center.
Yes.
Now we will go for.
So in this particular patient, not developed fusion, once developed, never lost. Most commonly it developed until 18 to 36 months. Okay, it will start from birth until 36 months very fastly. But it can also crudely. This is a very sensitive area. Okay, until 36 months. But crudely it can develop until 5 years. Okay, crudely. In this 36 months you are so confident. This center coordinates the gaze and simultaneous focusing of visual axis on the object being seen. Coordination between the two eyes is carried out by the fusion center through the efferent pathway. We have studied previously. Okay? In this particular patient, what is the problem in efferent pathway? Defect in gaze center, motor nuclear ophthalmoplegia, motor tracts, internuclear ophthalmoplegia, no. Motor nuclei, motor nerves, neuromuscular junction, muscles.
Yes.
Fusion hasn't been developed.
Efferent pathway, efferent pathway, muscles. From the fusion is not developed. Afferent pathway is okay.
These extraocular movements are normal, then how much?
You have seen any patient who has a strabismus?
In scenario.
Extraocular movement is normal. There is a good movement. Okay, movement is okay. But here is esotropia. Acha. So what we can do for this patient? The most important thing that afferent pathway, patching of normal eye 2 hours per day to prevent amblyopia. Okay, his if the right eye is straightforward, this eye has problem. So there is problem in left eye. So what you have to do? You have to patch this eye, good eye, and allow this eye to avoid amblyopia. This question has been asked by Dr. Kazi Sahaf in round from me. We have done one eye cataract surgery. The patient had bilateral cataract surgery, small child, and he has asked me, what you will do on this patient? You will advise glasses? I said, yes, I will advise. He said, no. Until next cataract surgery, you will not advise. You know that if there is unilateral cataract, it is more strong stimuli for the amblyopia.
नहीं होता जैसे वो जब उसको वो क्या कहते हैं प्रोसेस में भी तो ऐसे ही होता है ना कि जब उसको दोनों आंखों का है तो वो फिर भी ऊपर करके ना ऐसे फोर्सफुली वो देखने की कोशिश करता है। अगर उसको एक आंख का टॉक्सिस है ना तो वो एक आंख से देखता रहता है, दूसरी आंख को वो लीड ऊपर करने की कोशिश ही नहीं करता। तो अगर उसको यूनिलैटरल टॉक्सिस है तो उसको amblyopia के चांसेस ज्यादा हैं एज कंपेयर टू
We
बायलैटरल।
have a case on that. Don't worry.
नहीं ये दोबारा पॉइंट समझाएं अतः भाई वाला क्या कहना
Acha, what I am saying, in afferent pathway in this particular patient, what we are doing, we want to, this child which is 2 months old, he will be alive for next 100 years, okay? What we are doing, we have to patch his normal eye 2 hours per day to prevent amblyopia in squinting eye till the day of operation and correct any kind of refractive error.
No.
If there is any refractive error, you said.
Yes, correct.
Okay, you can correct that also. That is not a big matter.
लेकिन उसमें क्यों नहीं कर रहे थे जो मिसाल
एक
बताई
एक हमने जो कैटरेक्ट की सर्जरी कर दी,
उससे
ठीक है, बायलैटरल है, ठीक है। जब तक हम उसको हमने एक एक किया, ये कह रहे हो
जी,
एक किया
वो पेशेंट yes,
तो हम वो नहीं देंगे तब
कांटेक्ट
तक
लेंस भी नहीं लगा रहे हैं।
वो यहाँ था।
अच्छा नहीं
हम
नहीं
इधर
नहीं
अपने
नहीं
उसके मैचिंग कर देंगे तब जब तक हम दूसरी आंख को पीछे पेश करते उसको बायलैटरल ग्लासेस दे देते हैं डॉक्टर उसकी दूसरी आंख जो है ना वो तो स्कूल में होती रहेगी उसमें कहता है
अच्छा, let me to complete this, then you can discuss your own cases, please. Okay, we will complete this, just we have 10-15 minutes. So patching of normal eye 2 hours per day to prevent amblyopia in squinting eye till the day of operation, correct any kind of refractive error. Okay, and efferent pathway, what we can do, there is for example overaction or underaction of one particular muscles, so surgery before 18 months, we know that our fusion develop more in from 18 to 36 months, from birth until 36 months and improve very well, but after 5 years, until 5 years it can develop good. So we are taking benefit of that 18 months. Okay, what we are doing in this particular patient, medial rectus recession and lateral rectus resection. If I have weakened this medial rectus muscle, okay, so it will allow to come here, and if I have strong this lateral rectus, so the eye will come like this. Okay, that is a different scenario that how we are doing rectus and recession and resection. Okay, how about fusion? Fusion will develop when we address afferent and efferent pathway in this age, because fusion is developing until 36 months very fastly and until 5 years crude. So what will be the prognosis? How you will say to the patient, parents, the question I have asked at the start, doctors, will the eyes will be straight, or will that will be straight forever or not? If we follow this sequence, okay, if you follow this sequence, afferent pathway, okay, if you follow this sequence, afferent pathway, you have advised the patient that your eyes, normal eye should be patched 2 hours per day, okay, and then you have asked in 18 months that you have to go for surgery. So there is now intact afferent pathway, fusion center developed, and efferent pathway you have done the surgery. So now there is no any kind of interruption in this triangle. So the patient will have an excellent prognosis. There will be no diplopia, there will be no recurrence. Good?
It will be straightened with stairs.
Yes. Acha, refraction and patching of better eye for afferent pathway, surgery before 18 months of age if deviation persists. Okay. For efferent correction, bringing the two visual axes within 3 to 5 degrees, thus allowing fusion to develop. In summary, refraction and patching of better eye for afferent pathway, surgery before 18 months of age if deviation persists. For efferent correction, bringing the two visual axes within 3 to 5 degrees, thus allowing fusion to develop. We have developed all parameters: afferent, fusion, and efferent. Any problem?
No.
Any problem?
No.
And we can say very confidently to the parents that everything will be okay. if they develop early. Okay, if they develop later, that have different rules, and we will discuss that later. What is the summary in this particular patient? Preventing amblyopia. For example, the patient present to you in 2 months, you can prevent amblyopia. If the patient is presenting to you after 36 months, so at that time you have to first do this amblyopia treatment, then another kind of treatment. In this particular patient, we are preventing amblyopia. We surgery to bring the eyes reasonably close to let fusion develop. One important thing, we have improved, we have avoid amblyopia. Number 2, we have allowed fusion to develop because it's very faster in this age. Or if you lost this fusion, so for example after 5 years, this is lost forever, you do any kind of surgery, no benefit. We will study that in the second case. Look with Sahaf triangle, if you dissect problem, it become easy, but in book they have not mentioned fusion anywhere. Anyone heard this word fusion previously? What they are saying and how they are stressing on that?
उसमें fusion की grade बताएंगे, binocular signal vision, scale से
अच्छा.
Squint by chapter नहीं है.
Okay. Chale, we will study that. So this Sahaf triangle is an age patient who has given with this particular rule number 1. You can manage the patient of 2 months, 10 months, 18 months, 36 months, even until 5 years with this particular case. Okay. Acha. Case number 2. In case number 2, 12-year-old boy with alternate convergent strabismus. Okay? Alternate. Sometimes this eye has strabismus, sometimes this eye. Presented to OPD since birth. Okay? His vision in both eyes are 6/9. Extraocular movement are normal. Fundi are normal. अच्छा, good.
सर्जरी करेंगे लेकिन पूछे नहीं कि दोबारा तो नहीं हो जाएगा, तो उसको हो सकता है.
Then okay. Try करो. ठीक है. 6/9 vision है. अच्छा ठीक है. Done. ठीक. How? Which eye? This is the patient. One eye, that is. This is another.
Either lateral resection of the both eyes, or a medial resection of the both eyes, or if we go for the one eye, then we do lateral resection of the one
Resection
and the medial resection of the second.
So one important thing in strabismus, all strabismologists around the world, they have taken one decision. This is so important. That you have to avoid as possible as you can resection. Because we are losing our tissue. We have to go every time for resection. This is not related to this particular patient. Just I'm giving this. This is the decision. Okay? As a strabismologist or as a general ophthalmologist, you have to know. Chalo, we are what was our 2 things. Number 1, we will dissect the problem. Okay. Number 2, we will systematically solve the problem. And number 2 is we have to focus on fusion center. Chale. What will be the parent question? Same question.
सीधी हो जाएगी लेकिन दोबारा भी टेढ़ी हो सकती है.
अच्छा, good. कैसा? How much?
Properly.
जी.
Fusion center proper develop नहीं हुआ. 12 साल तक आया, 5 साल तक हमारे पास टाइम है. 12 साल पे आया और उससे पहले उसने कुछ किया भी नहीं.
अल्टरनेट का मतलब दोनों में विजन गुड का फ्यूजन.
जैसे ये सिनेरियो से हो कैसे सकता है कि इतनी एज तक पहुंच के अल्टरनेट्स को इंटर 6/9 भी.
ये सिनेरियो है. अच्छा अब बताएं अहमद मसूद, what you are doing in our department in this particular patient?
It was since birth.
It was since birth, alternative
At 12
squint,
years of age.
6-9 vision, extraocular movement is normal, fundi are normal. There is a question, parent will ask the two question. सीधा हो जाएगी और रहेगी या दोबारा
सीधी हो जाएगी लेकिन दोबारा
हो सकता है? How much?
जितने
How much is chance? 50%, 60%, 30%? There will be diplopia or not diplopia? How?
हम उसका डिपोस्ट और डिप्लोपिया टेस्ट करेंगे तो
And how much that is reliable is the next question. Chalo, we will start. So we will find the answer for this particular patient. So we are dissecting the problem: afferent pathway, fusion center, and efferent pathway, one by one. Okay, let's take each separately and dissect. In afferent pathway, what is the problem in this particular patient? No problem.
हाई तो नहीं है
6-9 vision है.
उसको 6 कर सकते हैं.
If I say it is normal, no refractive error, how you will give the answer for
sensory
this?
employee.
Good.
कौन सा नंबर
मतलब amblyopia है. Amblyopia.
6/9 को एम्प्लॉयी में ले
So this afferent pathway is okay. No corneal opacity, no cataract, no vitreous opacity, no retinal disease, no congenital ptosis, no sensory amblyopia. There's a little sensory amblyopia. We can neglect that. Okay. In efferent pathway, what will be the problem? Huh? How?
How
We-
the extraocular movement
Normal.
So we have this list. When you are managing any patient of amblyopia on this triangle, so what you have to do? You will remember this list: afferent pathway, causes, efferent pathway, and fusion center pathway. These are some lines you have to remember that, and you have to rule out one of that. So all these, there's no defect in gaze center, no motor tract is normal, motor nuclear normal, motor nerve normal, neuromuscular junction is normal, muscles in misalignment. He had misalignment. Okay. Now how about fusion? Huh?
That develop.
Not developed.
मैं थोड़ा सा कंफ्यूज हूँ
Fusion not
No problem. No problem.
Not developed properly.
not well properly.
Myopia
लाइट पड़ेगी
Not developed properly.
जो
मतलब जिससे 5
different pathway है
होना चाहिए ताकि
different pathway है extraocular movement was full or not if the extraocular movement was full then there shouldn't be a defect at different pathway
How many patients of Strabismus you have? In that patients, they have Strabismus, but their extraocular movement are normal. Okay? They're normal. Just wait, okay? We will find it. So fusion is not developed in this particular patient. Why not developed? Because that is not in the sensitive age. What was the sensitive age? 18 to 36 months, and that is under 5 years. So this center coordinate the gaze and simultaneous focusing of visual axis on the object being seen. Okay? Coordination between the two eyes is carried out by fusion center through the efferent pathway. Okay? Fusion is not developed. What we are doing in our department, this is most important. Maybe you have seen some doctors, they are asking from the patient, do you have any picture during your childhood? They are asking for the ID card. Okay? Why they are asking for that? Because just they want to confirm that his eye was for a time aligned or not. If that was aligned, then that's good. That has a good prognosis. Because we said if the fusion once developed, never lost. Okay. So this the importance of this was I have, maybe you have seen Dr. Majid sir. He is asking. I have asked you, what is the importance of this? Why you are asking one picture? Based on that you are doing surgery. So this is the importance. So fusion. This is congenital strabismus. Acha, fusion. In fusion, what is it? This is congenital strabismus. Eyes were never straight. We have stated at the start of the case that this is congenital since birth and never had a chance to develop fusion. So he has not developed fusion. This is afferent pathways, normal. Fusion center, not developed. Efferent pathway, misalignment. So what we can do? We can do anything for fusion center?
No.
What is the next option?
Surgery.
Efferent pathway. So the aim for this, why we are doing surgery for this particular patient? We know that there is not good prognosis, not good. G?
To prevent.
Good. Huh?
No, for the prevent employee okay to prevent.
Good. Good. G? Good.
और लेकिन पूरी साढ़े 18 तक पे चल रहा है.
So this is our aim. In this 12-year-old boy or girls, we can go. Why? Cosmetic, for cosmetic purpose, especially for girls, to find a good customer. It was a joke, especially for girls. I will say one patient last 2 weeks back, hey, who has shown to be? She was a 16-year-old girl and she had 660 vision and her eye was like this, okay, 45 degree. You have seen the patient? अच्छा. हाँ, पता नहीं उसके पास माँ था. So I have asked mother. So what was the problem of her? No, I have asked, there is decreased vision. Her mother said, no, just align the eye, no problem. So be careful. Who is not married? So,
शादी से पहले सूचना देख लेना.
नहीं, complete ophthalmological examination. The eye is amblyoptic. That is straight.
We have to examine
But
the
he-
childhood picture.
During the
Correction.
ID card
So, this was just the story of that particular patient. She said, no problem, just if we do the surgery in this particular patient, if there is decreased vision, 660 or 45 degree esotropia. So again, the eye will be there is strabismus. So I asked, first patch the normal eye and allow the eye which has strabismus. So we will improve the vision. Then we will go for surgery.
But that's the if the issue is from childhood, vision center developed.
No. I am saying from that particular patient. Even this scenario is not this scenario.
Excellent result.
That scenario. What I have said two weeks back. Acha. Acha. So our aim in this particular patient is cosmetic, especially for girls, social acceptability. Okay. So what we can do with fusion? Fusion not developed, will not develop at this age because 12-year-old. After squint surgery, fusion keeps two eyes together. Okay. After squint surgery, fusion keeps two eyes together. If no fusion, squint can recur. Okay. But we are doing post-operative diplopia test with prism. Who has done post-operative diplopia test?
मैंने देखा.
देखा है? आपने किया है? अच्छा. So in that if the patient has a post-operative diplopia test that is negative, we are giving a good news to the patient that inshallah you will not have post-operative diplopia if we align the eye. Okay. But what about Sahaf triangle? What he is saying regarding that? Only fusion keeps two eyes together. Here, no fusion, no chance of fusion. Only fusion keeps two eyes together. Here, in this particular case, there is no fusion and there is no chance of fusion to develop. So, what will be the prognosis? Good to fair. Good to fair. Okay, we can say to the patient. Okay, maybe or maybe not be. So next, this is a very good question. This question I will ask from you. If we explain all kind of these problems to the patient, okay, and you ask the patient that maybe there will be recurrence, okay, maybe there will be diplopia. I will come to the percentage later. How much diplopia they will be like? चलो अभी बताऊंगा 60%, okay, or 70%. 70% there will be diplopia chance. Okay, your post-operative diplopia test is negative. Negative case. In negative case, in 60% they will don't have diplopia.
40 में होगा उससे ज़्यादा में होगा.
चलो बताऊंगा. So you have explained this all for the patient. And you have said that maybe there will be recurrence. Okay. If we explain all these poor prognosis and recurrence, no patient will go for surgery. And it trick, महंगाई तो है. क्या करना है?
वक्ती तौर पे बेहतर हो जाएगा.
No.
उसे कहना कि जब कोई आपका इवेंट वगैरह
हाँ?
शादी वगैरह
शादी के बाद Faraz, आप बताएं. So you are a doctor. Patient came to you, 16, 17-year-old girl or boy. He is asking.
Go for the patient.
You have explained everything. You have evaluated. You have done assessment. But you have said to the patient, maybe there will be diplopia, maybe there will be recurrence. What is the answer for this?
Percentage wise.
G?
Percentage wise.
So they will not go for surgery. They will not give 1 lakh, 2 lakh to you. So this is that.
उसे कह सकते हैं being a Muslim अल्लाह से अच्छी उम्मीद रखें. हम दे सकते हैं.
अच्छा. So
इस्लाम का हम यूज करके पैसा कमा रहे हैं. इस्लामिक
अच्छा, one thing, professionally, morally, we are bound that we have to say. Ethically, morally, and professionally, we are bound to say these all what it's called complications. But 30% of cases stay where we leave them cosmetically. Okay, we are doing this particular surgery. Our aim was cosmetic. There will be no recurrence in 30% cases. Diplopia mostly disappear because of suppression. So many patients are ready to take chance. So you can give a chance for the patient. Okay. जी ट्रिक ये भाई you have to say to the patient. ये explain करे, but they will take the chance. They don't want to. They want to find something good.
They don't want to.
They don't want to lose the chance. Okay. So in this particular patient, अच्छा, so this will be the last. In this particular patient, what we have discussed, afferent pathway is normal, fusion center not developed, efferent pathway misalignment. What is the plan in this particular patient? Refraction, squint surgery, infusion not possible. Okay, but some more patient they can take the benefit of this chance. Maybe they will not develop diplopia, maybe they will not recur. Okay, thank you.
Thank you, Dr.
So this was just 2 cases.
That's simple and
This was just 2 cases. We will inshallah discuss that one.
वैसे कुछ आपकी एक्सपेक्टर भी है आपने पूरा नहीं कराया
Over the year,
हाँ।
these were 2 rules.
अच्छा
This was session 1.
Yes, Samas.
That has different. This is a
Will you please share this slide with us? Dr. Allah?
जी
These slides are amazing.
ये जब कंप्लीट हो जाए उसके बाद कंप्लीट नहीं है।
फ्यूजन ब्रेक हो जाएगा
भाई ये क्वेश्चन है शायद वो आगे किसी टॉपिक में कवर हो जाए
हाँ।
एक कम कर रहा है